All right, all right. So today's interview is super special. We got the traditional program at University of Findlay in Ohio. Super excited to interview the admission member here and also some students that are in the program right now. This is going to be super exciting for you pre-PTs who are interested in this program or just any program at all. University of Findlay offers so many different ways that you can become a doctor of physical therapist. You make sure you're tuning in here because this is going to be so amazing. We have Miss Nicole Schrader here, who is one of the admission chairs of the program. And we have current students, Taylor and Zach as well, who are here joining us. Thank you everyone for your time here today.
Of course. Thanks for having us.
All right. So I'm going to kind of break this up into two different segments. First off, I want to ask like some facts and some cultures, like what is student life like? And then I'll go into more of like the admission type of stuff, like what makes a student stand out and things like that. So my first question to you all is, could you share a brief overview of the PT program and include some core values, please?
Who wants to go first? I suppose I can start off.
Sure.
I'll provide, I think our core values are probably best reflected through our mission statement. So kind of like our formal, core values are that we really strive to empower students to transform society through optimizing movement and function for the patients that they serve. So that's kind of, I think says a lot about our core values, which are really student focused. And we do try to do a lot of service and focusing on experiential or hands-on learning. But I'll let the students maybe say if they have any more informal things or core values that you think our program represents.
I really think the program kind of really keys in on helping the students be and transform themselves into good therapists that are going to be able to serve their community. The program really focuses on community service within the program. And I mean, ultimately, that's the goal of physical therapy, is to help others. So I think University of Findlay really endorses that in the program.
Yeah, and going on with that, I think that a big part of this program is the hands-on hands-on learning that we do. So like I walk into our first day of PT school and our tables are plinths, our PT tables. And I'm like, whoa, we're definitely in a PT graduate school here when we're having our tables be plinths. So it's cool to be able to use those to do a lot of hands-on activities when it comes to learning, because learning's not all just in the mind, it's a lot of doing. So that's a big part of the program.
Awesome. Yeah. Thank you so much for that. Yeah. I love that. You guys are using tables or plinths as tables and tables as plinths. Definitely in the PT world, there's a lot of kinesthetic learning, hands-on. You have the lecture and the lab. So love that. Even on your first day, it's like, whoa, like we're really getting into this. I'd love Zach and Taylor, I'd love for you to both share a little bit more about what student life is at specifically at UF. I don't know if you guys are from the area or you had to just you were from a different area, different state, but yeah, just love to hear your perspective on that.
Sure, I can start, Taylor. So student life at Findlay, it's very nice because not only in the program are there different activities that we do, but there's also a ton of extracurricular activities that you can do at Findlay. But more specific to the program, I think the very cool thing about student life is that you're with a cohort for every class. And so you get to know these 18, 20 students throughout everything that you do. So you're going to every class together. You're going to every event together. And so like we'll often just have times where we hang out, or when we're playing cards after class, or just so we're doing finals right now. So we're gonna have time after finals just to chill and hang out and just detox and relax after finals. So I think that student life, although it is challenging with PT school, obviously having a cohort that is not against you and that they're all for you. They want you to succeed. It brings a lot of encouragement, to each student.
Love that. Hey, quick follow-up question. So you mentioned 18 to 20 students. So is that your cohort size?
So the max cohort size is 36. Like I think the third years have about 28 or 30, and then ours has 20 or 18. And so it kind of just depends on who or how many people apply for each year. But
right. Gotcha. Wow. That's a very close knit of students. Like it definitely is smaller than your typical, even high school classroom.
Yeah, right.
Yeah, Zach definitely hit the points there. I was just gonna say that it's really like a family environment here at Findlay. Since we do have that small class size, we've been with these 18 people for 2 semesters now, and I really feel like they're some of my best of friends and people I can lean on during times. It's awesome. I was on the volleyball team here at Findlay, and it's really cool being able to see some of my classmates in the stands and coming to supporting each other, going to each other's sporting events, or just whatever else in life. I know that they'd be there. So it's nice to have them in class together, but know that they're there for you outside too.
Yeah. I mean, it's so cool that you guys are just grinding together in school, but also extracurriculars like, playing cards, watching sports like that. I mean, I think that's this dream come true for so many students out there who just want a sense of belonging, a family type of setting. So definitely from what you guys are saying, seems like UF definitely exemplifies that.
Yeah.
I'd love to talk about like culture, like what is the culture like specifically, from Zach and Taylor and the PT students perspective end, and then maybe from faculty and staff, from Nicole. I'd love to hear what you think about culture at UF.
I can go. I really think that the culture in the PT program is like striving for excellence. Our professors don't just let us get by being average or just getting by the skin of our teeth. They really want us to know the information, to be able to apply it so that we can best serve our patients in the future. They don't want us to be that average physical therapist. They want us to be able to help all those patients, to help them get better, and having people refer to us because they know we're a good therapist and we're going to get the job done.
Yeah.
That makes me so happy to hear as a professor.
No, it's very true. And I think with the culture, I think I've said it a little bit before, but like the professors will often encourage us a lot, saying, you've made it, like you've made it to PT school. And so now it's not about who you can top and who you can or it's not so much about competing with your classmates. It's more about we're going to work together to, as Taylor said, be the best PTs that we can be. And so the professors do a good job at encouraging us in that way, to say, we are going to give you the tools so that you can become great physical therapists, but it's up to you on whether or not you're going to put in the work to actually do it, So they give us a lot of great tools, and so in undergrad, like a lot of our averages for our exams, they may have been in the 70s, because we didn't have as many students that really wanted to strive for excellence, as Taylor was saying. But now in PT school, it's if you don't study, if you don't put in the work, you're gonna get the low, So it's a big bar, but it's good because we're not competing. We are encouraging each other to do as best as we all can to be great PTs.
Love it. It's not competition, it's cohesion. Love that. Sure. Nicole, I'd love to hear from you. Like, what do you think culture is like?
I would have to say, and like I said, it's awesome to hear that as a professor. I have both of these students in class right now. So to hear them say that is awesome, because that is what our program does strive for. And as one of the faculty members, we look we view our job as really helping to transition to adult learning. And it kind of happens all throughout the curriculum, creating a supportive environments for students to do that. I always say, like, this is your safe space to learn and to grow and to go from student to clinician. So we really strive to provide that atmosphere and that culture. So I'm really happy to hear that the students said that. And I promise I did not coach them at all. I didn't give them answers. I was kind of wanting to see how they felt anyway. So that's without coaching.
Yeah, I'm sure that feedback, as as a professor, someone who's teaching, your own pupils are saying such great things about you, about the program. So I'm sure that's such a great feeling to have. So I want to know, why did you choose UF, Zach, Taylor, and Nicole? Why should a student choose UF? And I want to hear that from your guys' perspectives.
Sure. So the University of Findlay has a great way to have an entry into PT school. And so Taylor and I both we were in a program called the 3+3 program, where you do 3 years of undergraduate and then you go straight into 3 years of grad school for PT. And so you actually apply for that in high school to be able to be in that program. I think only about 15 or 18 students make it into that 3+3 track. And so you go into undergrad, and then you maintain a certain GPA, and then you go into grad school. But so that was obviously a big reason why I chose to go to Findlay, because it was if you maintain this GPA and you have these recommendation letters, then you'll be able to continue to move on to the PT program. But also just going to Findlay, I have found a lot of amazing community in my undergrad. And so a big part of it is I'm heavily involved in the campus ministry that's on campus. And so, like, I found a lot of great community involved in that. And so that has allowed me to continue to want to pursue going into PT at Findlay, because I found an amazing group of people in that, so that's definitely a big thing for me.
Awesome.
I'm kind of a little different from Zach. So I actually went to a different university my freshman year of college. I knew I wanted to go into PT, but didn't really know where I wanted to go yet. And after that first year, I kind of realized I definitely want to do physical therapy. And Findlay obviously offered that 3+3 program. So I was like, okay, I'm going to be ambitious and kind of get going with this, because I came out of high school with a lot of credits. So I was like, I want to enter a year early. So that definitely attracted me to Findlay, because I wanted to just get right into the field. So then I came, obviously, and I could not be happier with my decision to come here. I love the university, all of the professors. They really want you to succeed, and they're there for you for whatever you need, whether that be for school or outside of school or any of that. And I obviously got to keep playing in my volleyball career, so that was another positive. But
Wow.
And I just love the Findlay area, so I plan on staying in Findlay after I graduate. So that's just
Nice.
icing on the cake.
Yeah. So I want to ask you a quick question as a follow-up, just because your path is a little different. So those who are listening right now, 3+3 means 3 years of undergrad and then 3 years of DPT school. So it's a very specific and special program that UF offers. But Zach, it seems like you went straight to UF, and then you entered through that program. But Taylor, you went to a different program or different university first for your first year, and then you transferred, and then you got into the 3+3. How does that work? Maybe you can answer that, or maybe Nicole could answer that.
Yeah, so from my understanding, Findlay has the two options of getting into the 3+3. So they have an early admit for freshmen, like seniors in high school can apply for that and get into that. And then they have that other option, which is kind of how I went. And that is you just go through like your normal undergraduate and complete basically all the requirements you need to complete, and then you can just apply for the program and go through the DPT program before you get your undergraduate degree.
I see. And then is there a deadline as to like when you can apply to that 3+3 program? Because you can't be like a junior or like a sophomore or junior and apply to that, right?
Yes, I'm kind of an oddball because of my like college credits and everything, but I
Right.
applied with what have been my, I guess you can say, junior year of college. And so you just apply basically as if you were a graduate student coming from a different university. So you still go through like the PT CAS and do all of that. You just don't have your undergraduate degree yet.
Gotcha. Okay, so just to clarify, as long as you meet all the requirements that's required for the 3+3 program, whether you're a sophomore or second year or third year, if you're eligible and you get accepted into that program with all the requirements, then you can go straight into the 3 years of DPT school, and then you'll get a degree, undergraduate degree in that process as well, and then at the end a DPT as well. Am I correct on that?
Yes.
Yes.
Okay. Wow. So you're finishing in literally 6 like concrete years versus 4 years, 5 years, 6 years of undergrad. You never know, especially nowadays. And then 3 years of DPT. So you're saving a lot of years by doing this 3+3 program. That's fantastic.
Mhm.
Nicole, I'd love to hear from you. Why should students choose your program? Choose
how much
UF.
time we got? Yeah. We could be here a while. Not only do I teach there, but I do. I strongly believe in the program. But I guess if I were going to boil it down, into a few different points, I would say that the different avenues to get into the program are really nice, and something that I wish I did have when I went to PT school. I did the traditional 4 years of undergrad, 3 years of a doctorate degree. When I applied, I didn't know if I'd get in. There's hundreds of applicants and only the school that I went to 28 spots. So it was stressful, to say the least. But Findlay does have those 2 really great options for the early assurance, or like the early admit that Taylor was talking about, and Zach. That we have certain criteria based on GPA and extracurricular involvement and things like that. But if you meet those criteria, you technically have a seat waiting for you in the program as a senior in high school. Provided you meet certain requirements in undergraduate, your coursework and maintaining a certain GPA. But I think that's a really great option and can be a great stress reliever for students. And the 3+3 option, shaving off an entire year of school, an entire year of loans, if you have to take out loans, and just getting out into the workforce a lot earlier is a great option. But we also, so those are some of the maybe more like concrete or sound judgment decisions. But I think too that YUF for PT program is we really strive to provide like that close-knit supportive environment for students to grow into clinicians. And that is, I think, and our dedicated faculty to do that kind of maybe sets us apart from other programs.
Yeah. And I also love the opportunities that UF offers for students. It's not just one program and that's it. It's like, look, we're open and willing to meet you halfway, whether it's an early assurance program, a 3+3 program. UF also offers a bridge from PTA to DPT program and your traditional program. I mean, most programs only have one, which is just a regular, grad school. So yeah, the fact that you're telling me about how faculty and staff really just want to meet students and create that close-knit environment, just even from the opportunities that UF offers demonstrates that. So thank you for sharing that. Nicole, I'd love to hear from you. What is the clinical experience like? Like, what are the clinical experience opportunities? What should students who are going into your program expect? How many weeks, how many rotations, like all those things about clinical rotations.
Sure. So I can give you some of the basics because I'm not our director of clinical education, but overall, traditional students have 33 weeks of clinical education, throughout 4 different clinical experiences. Typically they'll do like a musculoskeletal clinical, a neurological clinical, sometimes called like we also do like an other, especially if students are interested in like pediatrics. And then there is a specialty clinical. So students for those will typically go on, public health is kind of a booming area of PT right now. So that's their opportunity to maybe participate in an athletics clinical. We have some students that have gone to clinicals for professional sports teams or public health or something like that. So,
Nice.
and that's typically the last clinical before you graduate. And the first clinical is right after the first 3 terms of academic coursework. So they kind of do a summer, fall, spring of coursework, and then they'll go into their first clinical that following summer.
Wow. And then you said it's 33 weeks total, and then it's divided into 4. So I'm kind of doing the math here. How does that break down? Is it like 3 weeks short and then 10, 10, 10? Like, what is that like?
That's a really good question. I know there's, I believe, 2 10-week clinicals and then an 8-week clinical. So that's 28, and then a 5-week clinical, I believe.
I see.
Yeah, that's right.
I know there's one that's
Yeah, that's
shorter
right.
like that. A 5 or 6. Yeah.
Yeah,
Am
that's
I right? You guys probably know. Did you
think
just meet
so.
with Dr. Anderson? Did
Yeah,
she tell you?
2 weeks ago. Yeah.
Yeah. Okay.
Nice, nice. And then just to follow up on that one more time, the first clinical that you go off to after just 3 terms of being in school,
Mhm.
how long is that one? And is that typically the musculoskeletal one, neuro, like what? And does UF choose where you go, or do you get to choose where you're going?
So the students get to choose. We have clinical contracts set up all over the country. But the students kind of provide your top 3. Is that right? Like your top 3 sites that you would like to go to. And then our director of clinical education, they always try to place them at their first choice. But if that doesn't work because maybe they don't have, a CI or a clinical instructor available at that time, or they're not taking students at that time, then she kind of moves down to the list to the second or third choices. And the first clinical is that the 5-week one, Taylor and Zach?
I
Or
believe it's
7,
8
7 or 8.
or
Yeah.
7 or 8. Yeah.
Yeah, about 2. Yeah. So the first one in that summer term is 2 months. So 8 weeks, I believe.
Yeah. Wow. Just throw you right in.
Yeah.
Just throw you guys right in. Awesome. Awesome. And then I have one more question as far as just some facts about the program, and I'd love to get into some admissions questions, Nicole. But what are the future developments for the program? Where is the program headed? Is it just let's just do what we're doing and be really good at it, or are we adding some more labs, some more opportunities? What's the future hold?
Well, that's a great question. I just sent out a survey and we are big on getting student feedback and about our program and about what.
Oh, I think she froze on us, guys. Okay, so feedback. So hopefully Nicole will be able to get back on here. Maybe her.
Oh, there she is.
Are you back, Nicole?
Oh no, did I cut out? Sorry.
It's all right. It's all right. You were just mentioning about getting student feedback, and then you kind of froze a bit.
Oh geez, sorry. And I had a really good answer too. No, I'm just kidding. Um, what I was saying is that we do take a lot of feedback, and I just gave a survey last week, I think it was. We really strive to try to make the student experience as best as we can. So based on that survey, one thing I'm looking at is making sure that we have like a PT student house, which is basically a house on campus. The survey, a lot of students said that they utilize it and that they like it. It's kind of their own space where they can go to study and do group work or practice skills stuff. But my goal is to really make sure that that is a really welcoming space, that students really get the most use out of it. And so that's kind of my next step, is to see what else do you want there? Like what else is going to make that really usable for you? So that's one thing. And then also trying to get some more, well, I guess more scheduled tutoring sessions. A lot of the tutoring is kind of sometimes informal, or it comes from the professors, but we're actually going to look into how can we get, and hopefully even make it a paid GA position, which we have some GA positions right now for like anatomy lab and neuroscience lab, but maybe also add in a paid tutoring position so that the second and third year students could
Awesome.
have a job at this, and then help out
Yeah.
undergrad students to help them get where they need to be. So in a little bit more kind of one-on-one setting. So
Beautiful. Yeah, exactly in line what you said earlier. It's just you just really care for the students. You want to improve the student experience and care for them and love them really hard. So creating a hospitable space for them to either hang out, play, or eat, or study together, or even just like set them up for success and make sure they don't fail out of the class, because nobody wants that. Like once you're in, it's like your hours. So let's take really good care of you. So I love that, Nicole. Thank you for sharing that. All right, so I have some questions regarding admissions. So students who are interested in your program, whether they're a freshman a senior in high school, or they're in college and they're looking at UF and like, hey, UF is my top choice. How do I get in? What do I need to do? These are the questions that they're asking themselves. So I have some specific questions that I'd love to ask. Nicole, this would primarily be for you, but Taylor and Zach, if you feel you can answer or chime into this, I'd love to hear your opinion as well. But I'd love to hear, first off, just tell me what you're looking for in an applicant that is specifically applying to UF.
Sure. We really and truly do look for a well-rounded student. So not only somebody that excels academically, but also a student who is involved, whether that be through extracurriculars. It could be a sport like Taylor, or it could be more service-based like Zach, or even somebody who's been able to, be employed because maybe they've had to work throughout undergrad, or they've chosen to work. So we really look for somebody that's able to kind of not only excel academically, but also who shows us that they're going to be able to transition well, with that increased demand of graduate school, but also represent our program well and go out and serve their community as a really great physical therapist.
Nice. Love that you guys take like a well-rounded, holistic approach. That gives a lot of hope for students, because not all of us did hot in undergrad. And, I personally was a college dropout and had to work my way back up. And these thoughts of, oh my gosh, my GPA, it's not good enough, are, daunting this whole entire time. Are there any extracurriculars, sports, or jobs that kind of hold more weight or more important than others? For example, maybe a job in the customer service, or a job as a manager in leadership, or maybe a job that's just you're not doing anything related to the world of PT. Same thing with any extracurricular activities or sports or anything like that.
Yeah, that's a great question. I would say that in our rubrics and when we're looking at admissions, we don't necessarily weigh one extracurricular or one involvement over the other, but what we really look for is like depth of involvement, especially the length of the commitment. So committing yourself to even just one thing for at least a year is much more meaningful than volunteering for a couple of 5Ks here and there, so that's what we really look for. Not necessarily that one thing is more important, because I think everybody has their own values, and that allows us to admit students with their own values and backgrounds. But we do look for, like, have they done these things for at least a year? Because that tells us that they're able to commit and that they've taken it.
So commitment is a big process. Sorry, go ahead, Taylor.
Nope, I think you really see that kind of diversity across our cohort too, with the different experiences. Like I said, like I'm an athlete. I know quite a few other people in our cohort are athletes. We got people working different jobs, and just everyone's always up to something. We're never not doing things, and you can definitely see that throughout everyone.
Yeah, so it sounds like being involved with something for something longer is much more meaningful than, just getting one thing, one opportunity, one day at the Olympics or whatever it is. But I also know like the meaning of that experience, like what you gained from that, how you've learned from that, how you've grown from um, that moment of whether it's a 1 year commitment at, like cleaning toilets, right? Or, a 6 year commitment of being an athlete. Like, how can a student show that? Can they highlight that versus besides just like writing it down in the experience section of PTCAS?
I would say from an admission standpoint, that can shine through in your essay. We try not to bombard students with too many essays in our application. I think there's only one actually, but that's kind of your opportunity to give your personal background experience. And that's where students can maybe talk about their service or their background with PT and their observations with PT, or a family member that went through it and how that impacted them. So I would say that the one essay question we have is really focuses on personal experience. And that's where students can kind of go into that in a little bit more detail.
Yeah. This is a question for Taylor and Zach. What part of your application do you think was most valuable, helped you stand out? Taylor, you mentioned being an athlete. Zach, you mentioned being in ministry. But I mean, it doesn't have to be that. Just I'd love to hear, like, what do you think made you unique?
I think so I'm speaking about our application for undergrad because we didn't have to do PTCAS with the 3+3, but I think the one thing that I really focused on when applying to the program was my extracurricular activities that I did. I had a lot of involvement in a lot of organizations that involved people with disabilities. And so that was a big area that I have a very big passion for, especially with kids. And so that was a big thing. And then also just with the ministry that I had in high school and then into undergrad, that was another big extracurricular and service opportunity that I really took advantage of. And it wasn't, and one piece of advice that I would give for anyone that wants to apply is that you do these things because you love them, not because it's going to make you shine in application, like that's the biggest thing. You don't want to just like say, oh, I'm only going to do this because of getting into PT school. Like, no, you do it because it's a passion of yours. Just like we go into PT school because it's a passion of ours, so that was a big thing. I think extracurricular activities was a big one for me.
Gotcha. Thanks, man. Spit preaching over here, man. Love it.
Yeah, I'm kind of the same way as Zach. I love to participate in extra stuff. I like to volunteer. I've had a job throughout college. So when I was applying, since I actually did PTCAS, I really wanted to include all those extracurricular activities that I did. Like I said, I did them because I love them, but I felt that because I did them, it kind of gave me a step up because I was so involved and I had so many different experiences with different people that I just really was able to learn from. And I felt like I could showcase that to help me in PT school.
Love that. Nicole, what happens if a student is not as fortunate to think like Zach and Taylor, thinking ahead? They're in their junior or senior year and they're going to apply next year, and they're not really involved with anything. What can they do in this 1 year to just give them as much competitive edge as possible?
Sure. I would say if they're in crunch time and they haven't, really been involved in anything before, then I would say now is a perfect time to at least start something, even if it's, because you can always kind of call up a PT clinic and say, hey, can I observe, or a hospital, or, maybe a school-based PT, somebody. That way you can get an observation experience and use that and build on that and say, hey, like that's also a good time to reflect and say, is this really what I want to do? If so, like why? Like how did I feel like that was meaningful to me? Or why do I want to be a PT? Why do I want to do this every day? So I guess my best advice would be if you're on crunch time and you don't have anything else, try to get in an observation day and use that as your meaningful experience.
Okay. And when you mean observation, you said observation day, but do you mean more like just try to get committed or show commitment to one place and just stay there for the entire year before you apply? Is that what you mean by that?
Yeah, I mean, well, we have some students who they don't even do like the full year. One of the requirements for us is to do observing another PT before you get into PT school. And we actually you need 40 hours total. So that way we know that you've at least kind of been in the field and that this is really what you want to do. So if nothing else, if they could call up a local PT and say, hey, can I shadow you? You know, can I watch you for today because it's a holiday break in December or whatever it may be. So that way you can kind of do like a quick 8-hour day. It's not too much of a time commitment, but it shows that you do care and that you're, there for the right reasons.
Yeah, love that. Thank you. That you don't know how many students that I have that ask that question. So that's actually super valuable. Thanks, Nicole. I'd love to hear a little bit more on the back end, Nicole, on the administrative side of things. You said that you guys have like a rubric or a system of grading students. If you can, to whatever knowledge is possible, can you describe that system, that process for us, and how you use that system to select students or move them onto a wait list? What part holds more weight versus the other? I know this is kind of a loaded question, but this is important if you can answer it.
Yeah, I can give at least like the general overview. So things that are on the rubric are your GPA. You know, unfortunately, all PT students, we have to at some point pass the national licensure exam. So GPA is on there. Specifically, we have a separate section for math and science GPA because we found through our own statistics that those students at the University of Findlay who were able to have at least a 3.2 for a math science GPA were 15 times more likely to pass the NPTE. So we do have a separate section for that. So we do look at those things. But then there's also points awarded for other things like extracurriculars and service involvement, the essay, the letters of recommendation. So we kind of do a point system, with maybe for each section, if it's, let's say the letters of recommendation, it's 4 points for highly recommend, 2 points for recommend, 0 points for do not recommend. So that's where as a student, you could say, okay, what PT did I observe? And they really will give me a great glowing recommendation letter because that's going to get me more points on the rubric and hopefully get me an automatic accept versus a wait list.
Love that. Love that. I mean, we know obviously academics are the most like important part. I mean, it does definitely play a huge role in a student's success. But how about the other parts? Like, could you give maybe a priority order? Like what gets weighed more, like the essay, letters of rec, extracurriculars? If you can, I know it's kind of a case-by-case basis, but yeah, if that's possible.
Yeah, I would say for our program, it's first is GPA, then extracurriculars, looking at extracurricular and service involvement. We look at both. And then letters of recommendation in the essay. So those are probably the most important things that we look at.
When you mention in service, what does that mean?
Oh, sorry, just saying, we kind of look at extracurricular involvement, so work or athletics separately, then we look at service engagement, so volunteering for your community or church or organization or whatever that may be. So we really look at both, and there are points on the rubric for both, and that's to Taylor's point, what allows us to get, a well-rounded cohort with people from varying interests and backgrounds, and also give those people an opportunity who are maybe, not an athlete or who didn't hold a job, but they've volunteered for a year or more, or somebody who's an athlete but never worked and maybe didn't have a lot of time to do a lot of service things because of their athletic commitments. So we look at both, but we kind of weigh those separately in our admissions process.
Gotcha. Thank you so much. That's super clarifying, very helpful. Students who are watching this, I'm sure you're getting a ton of value. I have a couple more questions, and yeah, if anything else comes up, or if any of y'all want to mention something, feel free to do that. But if a student is applying, what are some common mistakes that you see that are really like, that's a red flag, that's working against you? Uh, you really shot yourself in the foot. Like, what are some common mistakes, and how can students avoid that?
Common mistakes. Well, more lately, I would say using an AI generator or chat GPT for your essay, because it's evident, and especially for our program when we're looking at that meaningful experience or personal observation experience, and it's just kind of an automated essay response, we can tell. So I would say that would be a no-go. That's kind of a red flag that we have. You having a letter of recommendation when they say do not recommend is a pretty red flag. And as bad as this sounds, because it isn't all about GPA, but if you have a low GPA, especially in a science course, you have a D or a C minus, or it's a lower, I guess, a lower grade, and you haven't retaken that course, that's to us is a red flag, because sometimes things happen, and we always take the most recent grade for science courses. Especially sometimes things happen, maybe you don't get off to a great start in your first year in college or whatever that may be, but we're going to look to see, well, did they go back in and retake that? Did they try again to get a higher grade? That's more meaningful than maybe your first go round not going well.
Yeah, yeah. I love to talk. I love to sit and kind of anchor down on the topic of AI for just a little bit. It's a growing thing, so I'm sure things are evolving and changing. But you mentioned someone using AI, ChatGPT. Like, how do you know? Is it through the human eye? Are you using AI to ask AI if they're using AI? Do you have a software? Like, what does that look like?
Oh, the tangled web that is AI right now, right?
Yes, yeah.
Yes, we do both. We do like a faculty member screen first, they'll read through it. And especially if they're kind of like, this sounds like it's been generated, then we do run it through a software too. And sometimes, that at least was our last admission cycle. As it's becoming more popular, we might even just kind of start automatically sending every essay response through it, just to be safe. Because an AI, to your point, it's everywhere, it's growing, we're going to use it, but it should be used in the right way. Use it maybe
Right.
to get an outline of what you want to say, or use it to as an idea generator, but not as a final product. Here I just plugged in a couple words, and this is the answer I got, so that's what I'm going to use.
Right, right. And as far as the AI goes, do you feel like you'll ever get rid of the essay portion? Because I mean, students are smart. They're going to end up somehow manipulating it in some way, and use AI and tell AI to personalize it and all that stuff.
Yeah.
At some point, at the end of the day, it's like, man, I just don't know anymore. We're just gonna have to get rid of it and interview them, or have them come in person. What do you think the future holds for UF?
That's a great question. And that's something that we've been talking about more and more as faculty. There are programs who are moving away from using an essay response. They're moving away from holistic admissions entirely. They're just kind of looking at GPA and maybe GRE, and that's it. We really don't want to do that. We do strive for that holistic admissions piece. That's really our focus. So I'm hoping that we won't get rid of it for that reason, because I think it gives students that space to tell us about themselves, and we use that in our admissions piece. But who knows? I guess we might have to fall into line with some of the other programs that are moving away from it. So we'll see.
Gotcha. And just to clarify, I think I did see the GRE is also required, correct?
Yes, as of now, that's something we've also visited. We may be changing that requirement. Whenever we make changes to our admissions process, they're always very evidence-based. So we've been looking at a lot of literature, and unfortunately, that's one thing where there are studies that show a really good correlation between student GRE scores and the NPTE. And then there are some studies who show a not very good correlation. So right now, we're keeping it because our statistics, like within our program, have shown a good correlation for students that scored higher, especially on the quantitative portion of the GRE, a higher percentage rate for passing, first time pass rate for the NPTE. So right now, we're keeping it, but it is something that we revisit pretty continually to see if we're going to keep it or get rid of it. So.
Gotcha. All right. Well, that's all the questions that I have. Zach, Taylor, and Nicole, thank you so much for your time here today. Before we end today's interview, does anyone have anything to add, especially for students who are looking into your program or going to apply to PT school? Is there any last little nuggets or things you wanted to share?
I guess one cool thing about Findlay's program is that we have classes Monday through Thursday, and then on Friday we don't have classes. And so the PT program does a pretty good job at dispersing it out. So we'll have classes Monday through Thursday, and then Friday, Saturday, Sunday is for the PTA to PT program. They utilize that weekend, and so we get Friday off. So that's a good day if you want to catch up on studying, if you want to work. It's very nice having that day that we can do what we want with it, with either studying or working too. So
wow, that's cool. Thanks for that.
Of course.
Taylor, did you have anything you want to share?
The only thing I can think of off the top of my head, another cool aspect at Findlay is we do get the opportunity to go to a cadaver lab. So we're kind of fully immersed in that. And I think we would all agree that it really does help our learning experience. I know not all programs have it, so that's kind of a cool snippet that we have.
Do you guys get to dissect from just straight, just a regular body, and then you make the first cut and everything like that?
Yep.
That's really cool. Awesome. Thanks for sharing that. And Nicole.
I would say the only other thing I really want to add is we've kind of talked about how our program is very hands-on, and experiential learning is one of our kind of hallmarks of the program. And we do get students out to clinicals early, but we also do a lot of pro bono clinics. We run a 6-week pro bono neurological clinic, which is so that's a part of the Neuro 2 coursework. So that gives students a lot of hands-on experience, kind of really treating that patient from start to finish for 6 weeks. And we also do an orthopedic pro bono clinic through our musculoskeletal and thorax classes. So students hopefully get a lot of hands-on work that only helps hopefully make them feel more comfortable before they get into those clinical situations too. So.
Right. Yep. Love that. UF gives back to the community in different ways, neuro and ortho. So lots of opportunity to practice and still be in that student mindset. Well, Nicole, Taylor, Zach, thank you so much for your time today. Really appreciate you volunteering to just add value to the pre-PT community. And hopefully whoever is watching this will be inspired to apply to UF, and you will see them soon. All right. Thank you, everyone.